So let's go through what is some of the key healthy aging concept and what do we mean by ICOPE. So obviously, we will see more and more older people in the streets. But this is not the issues. But the big issue is that we have to help out all these older people and see that how much they can live independently in the community. Although they may have some decrease in the physical and mental capacity, they are our senior people and we would like to respect them, and hopefully they can lead their life and in a very stable situations and transit to retirement and even the death of themselves. Um, when we talk about healthy life years, we are talking about that older people, they should live longer, but at the same time they should maintain their health as much as possible. So some of the statistic has been shown that people get older doesn't mean that they get healthier. So we have the responsibility to make them keep their healthiness as much as possible. But unfortunately, in the society, many of these healthcare services are fragmented. You know that some people are working on health sector, some people are working on social welfare sector, but all these people are helping other people. Unfortunately, they do not communicate well, so it turns out that these kind of services are fragmented. But this kind of fragmentation may not be good for the older people as well as the caregivers. So we would like to see that all these services are connected so that they become integrated. Hopefully, we can support older people to stay in their own home as long as possible. And that is what we call aging in place. So WHO actually have been paying attention to these aging issues in 2005, and they have published a report and reviewing what is happening around the world. And this report actually mentioned that we should emphasize intrinsic capacity across lifespan and try to decline the functional ability in the old age. So what do we mean by that? Intrinsic capacity, we will talk about it later on. And functional ability, again, we will describe the definition of these two. But the most important is that how we can promote healthy aging. With the concept of healthy aging, we can do a lot of things to support the older people to stay healthy in the community. So WHO work with many experts in the world and they formulate a framework called ICOPE, Integrated Care for Older People. And this ICOPE framework basically is talking about how we can work out a system that is well coordinated and we pay a lot of attention to person, that is the person-centered system, so as to maintain healthy aging. When we talk about healthy aging, we must mention that we want older people to develop and maintain their functional ability as much as possible. When they have sufficient functional ability, they may be able to take care of themselves and maintain physical, psychological, and social well-being. So healthy aging is a very positive way to look at aging. Everybody can maintain their functional ability as much as possible and they do not need to rely on others. Even though a person is in his old age, the person would maintain certain capacity, and this capacity we call it intrinsic capacity. This intrinsic capacity means that is the ability that a person possesses even though this person is in his old age. So the intrinsic capacity can be divided into 6 domains. Everybody may know that people may walk slowly, but this is the capacity about locomotor. So the locomotor capacity is talking about whether that person can walk around and move around. Secondly, psychological well-being. Here we call it psychological capacity. Means that that person can still maintain good psychological health. Cognitive capacity is another very important capacity the person should maintain in old age. That means this person can work out the logic, maintain the cognitive level, and communicate with others. Hearing capacity, that is whether that person can hear correctly and able to communicate with other people and hear what the other people say. Visual capacity, of course, is talking about whether that person can see things clearly. Vitality refers to the nutritional part of the person, whether that person can maintain good nutritional status. So all these 6 domains are called the domains of intrinsic capacity. Even though a person is in old age, we hope that this person can maintain this capacity to a certain level so that they can live independently. But of course, this is very ideal. As we go older, our intrinsic capacity may decline. Or in some situations, we have some illnesses. And in the situations that we have illnesses, the intrinsic capacity may decline as well. Let me give you an example. For example, a person suffers from acute stroke. Okay, in that situation, one of the intrinsic capacity, the locomotor capacity, may significantly decline at the stage when the person is suffering from acute stroke. That means this person cannot be mobilized. So whenever we have intrinsic capacity decline, hopefully we can maintain it as much as possible or retain it and revert it to a stable condition. So that's why when we talk about intrinsic capacity, we are looking at that moment and try to reverse it and so as to maintain a stable capacity. Give you another example. For example, a person is suffering from mild cognitive impairment, okay, MCI, mild cognitive impairment. Then the cognitive capacity may decline. But if that person can maintain that cognitive level to a certain level without further significant decline, that person may not go for dementia. So that is very important to maintain the capacity and keep it into a stable capacity as much and as long as possible. So that is the idea of the intrinsic capacity decline. If that person lost out all or most of the capacity, then that person have to depend on other. And that would be the situations that that person has to depend other people to take care of them. So you can see on the right hand side that as we grow older, our intrinsic capacity, the red line, would decline gradually, and the more decline that we have in intrinsic capacity, the more we have to use health services. And in the later situations, we may have to go for long-term care. And the environment would be very likely that the environment has to be arranged so that that person can maintain certain level of capacity. When we talk about intrinsic capacity, you can see that as we grow older, it may decline significantly. But we want to keep our functional ability, the blue line, as much as possible. So you can see the upward trend that even though the capacity is declined, if we can keep the functional ability as much as possible, then the reliance on others will be reduced. So hopefully we can keep the functional ability as much as we can, even though the intrinsic capacity is declined. So that is the concept of ICOPE. So in the early stage of old age, for example, in the age of 60 or 60 plus, that person may have some decline in intrinsic capacity, and yet this person can still maintain certain level of functional ability. But in the age of 70 or something, the capacity decline a little bit more, the functional ability gradually decline as well. So in the age of 80 plus, intrinsic capacity would drop significantly, and the functional ability, hopefully, it is not dropped that significant. So that is the idea of the ICOPE. We try to keep this functional ability as much as possible. So ICOPE is a community-based approach to help our older people to maintain or optimize their functional ability. We pay special attention to person-centered care. Person-centered care means that we take care of older adults as a person, that is comprehensively looking at the person's health. It's not fragmentedly providing certain type of care to the older people. So you can look at the ICOPE handbook, and that is available in the WHO website. And you can also download an app, which is called the ICOPE app from App Store, so that you can know about what is being provided by WHO. All these materials are designed in a way that can be used immediately. First of all, we can screen who are at the risk of care dependence. And then once we perform the screening, if that particular domain is not good enough, then we can go for a comprehensive person-centered assessment. Once we know about which domains have declined significantly, then we can work out a personalized care plan. So ultimately, we are providing support to this person. So the ICOPE implementation framework actually can guide us, the practitioners, to take care of the older people. But at the same time, it can help the policymakers and the program managers to design what kind of policies should be formulated and what kind of programs should be developed so that to support older people to live in the community. So here, if you look at a person who start with over here, this person may have some health needs and become more complex in the situations that he or she may have more than one chronic illness that he will have to start through the journey. First of all, it can go through some screening, okay, and the screening test could help out to look at what is happening in the 6 domains of the intrinsic capacity. And this can be carried out using the ICOPE app by the older people themselves, or somebody who have been trained to be the health ambassadors to carry out this health assessment or screening. So if you download the apps, if you are trained, you can help out to screen those older people who may be at the risk of care dependence in the community. And once you carry out the screening, and then probably you can identify which domains of the intrinsic capacity have some problem, and then you can go for a comprehensive assessment in step 2. After step 2, which is a comprehensive assessment and person-centered care assessment, then you can work out a care plan, which is personalized care plan for these older people. So if we look at that, I think we can see that ICOPE is good in a way that we try to connect different types of services together. Because once we work out the care plan, actually we are asking the service providers to work together so that the fragmentation can be reduced as much as possible. We want to see integrated care because only the integrated care can support older people to maximize their intrinsic capacity and functional ability. If a person is living in a particular district, hopefully this integrated care program or service can be provided to this person within the same neighborhood. So they should not be able to travel too far away from their home. So that's why we hope this integrated care model, integrated care service can be provided to them within the walking distance. Sometimes caregivers may not understand the challenges that we have in the old age, and they may have some ageism attitudes. So this is not ideal. So ICOPE actually call for every caregivers to work together and at the same time remove the ageist attitudes as much as possible. And we are going to work out interventions together because at the moment, many of these interventions are not being provided in the community, or some of the interventions are not focusing on intrinsic capacity and functional ability. So that's why we need to work out more interventions that could help to optimize our functional ability. So how does integrated care work together? Actually, we call for providing care in the communities that is very close to where older people live in. That is very important because we are providing, using the resources in the same neighborhood to support the older people to stay in their own home. And we also call for comprehensive assessment because only comprehensive assessment that carry out then help us to understand that what's wrong with the older people. With the comprehensive assessment, we are able to identify which domain of intrinsic capacity has some decline, and then we can work out a care plan. But the care plan should not be just restricted to one discipline. It should be shared with everybody. It should be shared among nurses, physiotherapists, care workers, health ambassadors, volunteers, and even caregivers at home, so that everybody know what to do and how to help older people. And of course, all professionals should work together. Here, we are not limiting the work for nurses, but nurses are working together with other professionals. And lastly, we want to engage and support the family caregivers so that they can support the older adults at home. So using the ICOPE approach, that is good in a way that we can rapidly find out which older people are in need of help. They are declining in intrinsic capacity, but they may not be able to tell you. So with the ICOPE approach, we can rapidly find out the cases. And then, once we find out and suspect about the intrinsic capacity in a particular domain, we should carry out a comprehensive assessment. And then we design a care plan for them. And the care plan, when we talk about the care plan, it can cover a lot of things. For example, we can talk about strengthening the muscle and build up some resistance exercise for them. We can provide nutritional support, encourage them to receive some oral supplements, etc. And at home, we can work out the environment and check out whether they can modify the home so as to prevent falls. And of course, cognitive stimulation should be provided so that the older people can maintain their cognitive level as much as possible. So this is an extraction of the ICOPE handbook. The ICOPE handbook is good in a way that it is showing the pathway that we should go step by steps. So for the ICOPE, step 1 is about the screening, and step 2 is about the person-centered assessment, so-called the comprehensive assessment. We encourage the ICOPE to be carried out in community, particularly in the primary care settings. For example, in Hong Kong, the district health center is a good primary care settings that is for us to carry out the ICOPE assessment. So here, if a person go through the screening and everything is okay, that means that there's no loss of intrinsic capacity, then we can just give out some general advice on lifestyle and then continue with the usual care. But if the person after screening and identify some of the conditions that may have some decline, then we should go for further assessment and see whether this further assessment can give us some insights about the insufficiency of a particular intrinsic capacity. So then we can provide some advice and provide some services to the older people. For example, we can provide some interventions, rehabilitations, and even palliative care. And these are just an example here, so that you can think about that what we can provide after the comprehensive assessment. So for step 3 is all about the development of the person-centered care plan. So in your practicum, you are going to work out step 1, step 2, and step 3. So that means that you are going to develop the person-centered care plan to your clients as well. So by the time when you think about the person-centered care plan, personalized care plan, you have to think about not only what nurses can do, but also what other discipline can provide. For example, if you find that your client actually have some visual capacity decline, then would you consider to recommend the older people to go to the optometry to have a further investigations about the visual situation? So optometry can be recommended, and this is what we do in terms of the multidisciplinary collaboration. So step 4 and 5 is talking about more support to the older people. For step 4, we refer to develop a referral system so that the older people can go for some specialists. This is the step 1 of the ICOPE, which is called the initial screening tool. We will go through it one by one later on in the section 2. But just give you an idea that this screening tool has 6 domains, and then it has 9 questions for you to ask, and then you can see which level of the intrinsic capacity that person has as well. And the screening tool basically is incorporated into the ICOPE mobile app, and you can use this mobile app to ask questions. Just to alert you that this app has 8 languages, including English and Chinese, but the Chinese one is a simplified Chinese characters. So step 2 is about the comprehensive assessment. We will go through this comprehensive assessment in section 3 and 4. Because it is so comprehensive, so that's why we divide it into 2 sections when we go through all these assessment tools. So I can conclude and say that the ICOPE framework is a very comprehensive framework. We call for shifting our existing idea, that the existing idea consider that older people are heavily reliant on others. But in the ICOPE, don't forget that we are looking at the intrinsic capacity. Everyone's intrinsic capacity can be maintained and reverted. So if we can provide good support, integrated care to the older people, they can maintain their intrinsic capacity and functional ability. So the most important is that we have to do some screening and assessment in a regular basis, so that we can look at what are the needs at this moment, and we have to talk to the older people and check out what do they prefer to have, and we have to work with them to set up some goals in a timely manner. So we are developing a care plan which is personalized to the older people together with the caregivers. And also we would need support from other disciplines. So we have to coordinate different types of services being provided in the community so that the services are the service providers are work together. So that's all about the very brief ideas of the intrinsic